There's definitely something going on. Question is, can we do this safely at home, or do we need to actually get you checked out in hospital?
Oh, no.
Got this, like, lump in my left buttock. It felt like I was sitting on a golf ball.
Okay.
The waiting times to see a specialist are very long at the moment, 6 months or so at least.
6 months?
Yeah.
Has it got anything to do with cancer or anything like that? Or is it too early to say?
One of the best things of the job is being able to put patients' minds at rest, particularly if they're worried about something which they don't need to be worried about.
Every patient is different, and some patients worry more about their health than others. Some people worry excessively, others don't worry enough, as far as I'm concerned. If they are worried about something, that's a normal reaction. We all worry about things.
Ultimately, what you really want is for someone to say, this will all be okay, and this is how things are going to be. That's often why they come to see us as doctors.
Hello. Hi, Ashton. Hi, I'm Dr. Ward.
Hello, nice to meet you.
Nice to meet you. Come and take a seat.
Thank you very much.
Right. So, what am I doing for you today?
I have on my finger, which you won't see because I've got gel on my nails, a black line.
Right.
And I remember it was a couple of years ago, actually, my nail tech said to me, you should really get that checked. But then since then, on my stomach, I have it's not really a patch of dry skin, but it's like it's like a hard little lump.
Okay.
But it's like the size of a pea, and yeah, so I just don't know.
So you want to have those both checked?
Yeah, because I don't know what it is. Whether to me, I could just be like, well, I'm getting older and things happen.
Older?
But then
You're
also,
only 33.
I know. But yeah, I just think, do I need to get them checked? It played on my mind last night. I saw something actually on social media that said
what did it say?
strange signs of skin cancer. You know, I know you see a lot of stuff, and I thought about that line, and I thought I've never had that checked. There's no harm in just getting it checked.
Okay. So, but you've got gel things over the top.
I have got a picture of it though that I took
Let's have a quick
while
look at the
ago.
picture.
So yeah, can you see the shadow?
Okay, yes. So there's a little line
Sometimes it's more prominent, because I remember the other photos I've got is slightly more prominent. You can't really see it.
Is there any ridging to the nail when you look at it?
Not really.
It's just the
no,
mark.
it's literally just the mark.
I mean, it's probably absolutely fine,
Okay.
because it's been there for a long time. My view is, though, that when you finally get those gel extra bits removed, come and see somebody so we can just take a little clipping from the edge of the nail.
Okay.
And we can send that off and just make sure there's not a little fungal infection or something like that that's going on underneath. But it's been there for a long time, hasn't it?
Yeah. So is this on my stomach?
Okay. That's probably different. I don't think it's related to that. Yeah. Do you want to show me?
Yeah.
Yes.
It's literally just here. I don't mind showing you. I'll stand up though. There.
Just that little one there.
It's so small.
Okay. So this feels to me, you're right, so it's sort of sitting, and it's been there for a while too, isn't it? Yeah. So this isn't a skin cancer, okay?
Okay, thank you.
Sit down.
I'll have a drink now.
So it's what we call a tiny little fibroma, okay?
Okay.
So it's like a little bit of fibrous tissue that sort of grows just on and under the skin, okay? In itself, it's insignificant, as in it's not going to turn into anything nasty. But the only treatment, if you were to think about having that done, is to have it removed. So you'd have to have it surgically removed.
It doesn't bother me.
No. And then you'd end up with a scar and all the rest of it. And actually, I don't think the NHS would touch it, to be fair.
No,
They'd say go and do it privately. So I can reassure her on that line. So not skin cancer.
Cool, thank you ever so much.
No trouble.
I'm absolutely gutted that I didn't have more to talk about. Thank you ever so much.
No trouble.
Bye.
Bye.
Hello?
Trust me to do the wrong door.
Welcome to the mobile surgery. Is it Sharon?
Yes.
Here for Dr. Beecraft. Great. If you just want to take a seat, she'll be out in a minute.
Oh, lovely chairs.
Great, aren't they?
They're unusual.
Hello, is it Sharon?
Yes.
Hi, come on in.
Hiya.
Hi, come on through.
Oops.
Oh, sorry. Have a seat. I'm Dr. Beecraft. Okay. How can I help today?
Can you put me right?
Oh, okay.
I am worried sick what this is wrong with me.
Okay, so I'm coming in new here, so tell me what's been happening recently, what's been going on with your chest?
Breathlessness. Now, whether I'm just panicking, because I'm the biggest panicker out, I really don't know.
Okay, and what are you panicking about?
Everything.
Tell me a bit more.
Well, because I just seem as though I've got everything's happened to me. I've had breast cancer. I had a mastectomy. After that, I had a heart attack. Then I got diabetes, and now I've got this osteoarthritis that is killing me.
Okay.
Killing me.
So you're worried there's something else with the chest as a new issue as well?
Yes.
Yeah, okay. So tell me a bit about the breathlessness at the moment. When do you notice it?
Any little thing. If I walk upstairs, I wouldn't say I am gasping for breath, but I do get a bit breathless, but I'm not sure if he's panicking.
As well, yeah.
You know, I don't know.
What kind of worries have you had?
That the heart failure's come back.
Are you starting to worry that your health is not where it used to be?
It's just that worry, really. You know, you think, is it something else? Is there something really wrong with me?
Try not to worry too much about it, because you're very healthy, and you have to remember that you're very healthy.
They're not cancerous, they're nothing nasty, and not going to give you any harm.
Thank you.
Which is the most important thing to say.
It's irritating, it's annoying,
It is,
but it will go away.
I think this may have just been a one-off and we can just forget all about it.
What a relief.
Now I know it's nothing to worry about, I will just get on with it.
Nothing that I see makes me worry at the moment.
No need to panic yet.
Not yet.
Thank you.
So amazingly, it looks like you went for your x-ray this morning. So it all looks nice and normal on your lungs, which is nice news. So they couldn't see any sign of any infection. There was no sign of any problems with the lungs or anything else like that. The only thing they noticed is this thing called a hiatus hernia.
I've got that,
which,
yes.
so they could see that on the x-ray, but I don't think that's related. That's just one of those things they saw.
Yeah, yes.
Okay, so that was good. And then I think you said you had some bloods as well.
Yes.
Let me just see if I can see.
See, I was thinking I'd got fluid on the lungs, fluid. Somebody's only got to say something to me, and then it's in.
the idea. Yeah, that's right. So the blood count is a little bit low. You're slightly anemic, and that might be what's making you feel a little breathless.
And I'm very tired.
But I don't have all the results, so I don't.
Okay.
It's a bit difficult to give you a full answer at this minute because I still need some of the other tests to come back because that will help us put things together. Can I have a little listen in there? And
Yes.
see? Let's have a little listen. So nice big deep breaths and out. Okay, and let me have a little listen on your back. So I'll just lift this one up if that's okay. And some nice big deep breaths again. Okay, well done. So it sounds pretty good in there.
Okay.
Why don't I suggest that we get you back in a few days' time when I've got your other blood tests.
Okay then, okay.
So the good news is that the chest x-ray...
I'm so pleased, you know, I could
put your
hook you
mind
for
at
that,
rest,
yeah.
So that's put your mind at rest, which is good, but it would be helpful to have all the blood results back to help us decide where we go with this next.
Yes.
Also, it will be interesting to see, do you feel any better in your breathing now that we know that the x-ray's fine?
Yes.
Because like you were saying, it's on your mind and how much of that's adding into it as well. Yeah. Okay.
Yeah.
Perfect.
Thank you so much.
So come on through and then we'll try and get a date to come back in a few days.
Okay, thank you very much.
No problem.
Oh dear, I can't put on no more weight, can I?
That door's a bit funny. Come on through.
Nice to meet you.
Nice to meet you. Nice to meet you.
Please. How can I help?
Currently, the situation is I've got this like lump in my left buttock, quite close to my anus, and basically when I squeeze it, there's this weird like I'd say it's like a mucousy, like foul-smelling thing coming out. And sometimes when I sit down, like at the office, if I just like put my weight on my left, it'll pop, and I can feel it pop. But it was like a kind of weird discharge kind of thing.
Okay.
So this started like back in April 21, and there was this kind of like lump that was developing, and it swelled up quite a lot to the point it felt like I was sitting on a golf ball. And I kind of waited a week, and then it kind of went down and it went away, and it reoccurred again in the summer, and that's when I thought, oh, it's not gone away, it keeps reoccurring.
Yeah. Bowels are okay?
I don't know actually, because the stools are a bit like inconsistent. Do you know what I mean?
Right, okay. There's no poo coming out through this.
No. It's like a liquid. Obviously, it's foul-smelling, like liquid kind of thing.
Can we have a look?
Yeah.
Do you want a chaperone to come in?
No, it's fine.
Okay.
I don't need a chaperone.
Have you had a busy day?
Yes. So I've been over to do my shopping this morning.
Oh, lovely. Oh, that's good. Was it food shopping or like fun shopping?
Actually, I think it was more beer shopping.
Oh, okay.
Yes.
That's fun shopping.
Yes.
Have you got a party coming
No,
up?
I've got a husband that drinks.
Ah, I see. That's fair enough.
Oh. Hi there, is it Cynthia?
It is.
Hi, would you like to come in, love?
Yeah. Oops.
Yeah. Oh dear, you're struggling a bit.
Sciatica, it's all right.
Oh dear, is it a long time?
5 years. It's been bad. But,
Good and bad days, eh? I'm Debbie, I'm a nurse practitioner.
Yeah.
What can I do for you today, Cynthia?
Well, I've got this place on my leg, which is not healing, and it itches all the while. And I had a similar on my neck 6 years ago.
Yeah.
And I had it off, and it was skin cancer.
Yes. And you've had this for how many months?
It's been coming, I think, gradually getting bigger for the 2-3 months.
We've got a fancy light here that we might just have a better look at it.
Just not healing, and it's getting bigger.
Yeah, and I think you're very right to come. So you've had lesions removed before. You've had a lesion removed before.
Yeah,
so
here on my neck.
There on your neck, and this is bigger than a centimetre. It's not smooth around the edges. It's got some little raised areas and it's got some flaky areas. Has it ever bled?
No.
No.
I am quite controlled, and as far as scratching is concerned.
Yeah.
But I could rip it off, actually.
Is it
some
really
days.
itchy?
Yeah.
So I think you're right to come. You'll know because you've been to the dermatology clinic before. I can't look at this and say to you, this is fine, or this is a skin cancer, because that's why we have these specialist clinics. So we refer every lesion that comes and doesn't heal, causes itching or bleeding and gradually gets bigger, we refer them for the specialist to look at them. And they either whip them off or do a little bit of a biopsy that can tell them it's something that they don't have to worry about.
Yeah.
So I will do that for you, and we'll get. They usually see you quite quickly within a couple of weeks.
Yeah.
Is that okay? And they'll do
It has grown quite big.
Yeah,
because
it's a
it
fair
was just
size
like
to
a
say.
pinprick.
Yeah.
At the beginning.
It is quite a fair size, really, to say that you've only had it for a couple of months.
Yeah.
Yeah, so it's growing quite a bit, and I think it needs to be looked at by a specialist. Are you happy with that?
Yeah.
Yeah.
Okay.
Is that
Thank
okay?
you very
It's
much.
lovely to meet you.
Would you mind just giving me,
Of
letting me
course.
pull on your arm a
all
minute?
part of the service, eh?
Thank you.
Do you want me to help you down these steps, love?
Yeah.
Thank
Bye
you
then,
so
thank
much.
you.
Bye. Have a lovely day.
Okay. Oh. Oops. That's it.
Don't want you falling. That's the last thing we want.
Yeah. Oh dear.
See you later, love. All the best.
Thank you.
Cute, wasn't she?
She was lovely.
If you can draw your knees up a bit more than that.
Yeah.
So that's it. Okay. So it's on the left. Is that right?
Yes, it's like I can actually feel it there. I can kind of pinch it, if that makes sense. And when it comes out as well, I feel like it's not coming from your anus, if that makes sense.
Yeah.
I don't feel any sensation.
Is that it there? Is it?
I can't really feel.
Point to where it is, and then.
So it's like there. It's like a tube that kind of goes
okay.
straight to my anus, if that makes sense.
Ah, there. Yeah.
Can you
So
feel
that's-
it?
Yeah. Gonna get yourself dressed. Thank you so much. So I think you've got a chronic abscess or something like that, and that's what that tube is. And I think it's emptying out. Do you want to check these back? They're yours, aren't they? You have
it feels like a tube. That's what I was like.
A tube, yeah. But I wonder whether the tube. Well, I wonder whether the abscess is further inside, and the tube is the passage that's formed for the abscess to discharge. And it feels like if this is your bottom here.
Yeah.
So the tube is just there. Maybe it's much deeper inside, and I think there's a small entrance right on the anus.
Right. Yeah.
You've had it for 18 months.
Yeah.
It's probably not going to get better by itself.
Yeah, that's why I was like, I need to ring up and do it.
So I know you need to see a colorectal surgeon to examine you. Maybe even get a scan done to see what there's a collection, and this may well require an operation to get into open it out. I can ask a difficult question now. Have you got private health insurance?
No.
Okay, I'm just concerned how long it's going to take to get these
okay.
seen. In the meantime, all you can do is keep squeezing out.
Yeah.
Now, I could give you...
it's not painful. It's just something I know is not right.
Yeah. No, it's not normal. It's absolutely not normal,
yeah.
and it needs sorting out, and we need to sort it out for you.
Yeah.
Definitely. Okay.
All right, thank you.
Thanks for coming in.
You've diagnosed it, I think. Well, hopefully, so thank you. Right, well, that's great. Thank you very much.
Take care.
Cheers.
Thanks for coming.
Hi, I'm Dr. Taylor. Nice to meet you. Come in. Have a seat.
Hi.
What can I do for you?
Well, got quite a tight chest.
Okay.
And I know it's quite difficult walking any distance.
And how long have you felt like that for?
This morning.
Okay.
I know I'm sort of prone to this in some ways because I have a hypertrophic cardiomyopathy. I'm in AF at the minute, I think.
Okay.
Kay has an underlying heart condition called hypertrophic obstructive cardiomyopathy, which is serious. She also has atrial fibrillation, which is an irregular heartbeat, and it's often a fast heart rate. Patients can suffer with it chronically, and it can cause some symptoms, or sometimes it can cause no symptoms. But if it's out of control, it can stop the heart pumping properly. Can I just get you to slip your jacket off?
Yeah, sure.
And let's have a listen to your heart as well, and then we'll have a listen to your lungs. So the tightness in the chest started this morning, but the irregularity has been going on all week.
I haven't had a cold or anything, but I was in Berwick-on-Tweed last week, and it was really just cold and miserable. So I just wonder if I've picked up a
You're
chill.
really struggling to finish your sentences, though, aren't you? I'll just listen to your heart rate first. I'm not really very happy with that number.
No, it's not very good, is it?
No, I'm sorry, it's not. Well, that's...
Oh, it's got up to
there we are.
95.
Well, that's having a little play. Let's just have a listen to your back of your chest. Just nice, slow breaths through your mouth open when you can. I'm worried about Kay because she's got her underlying heart condition. Her atrial fibrillation is going quite fast, so her heart's probably not pumping as well as it should. And she's also got signs of an infection in her chest and is struggling to get enough oxygen around her body. So this could all lead to her deteriorating quite rapidly. There's definitely something going on. We definitely need to get you some steroids, I think, and some antibiotics on board. Question is, can we do this safely at home, or do we need to actually get you checked out in hospital?
Oh, no.
I don't think I would be being a very good doctor if I let you go home, if I'm honest.
Right.
All right. I think we need to be safe
Okay,
with
then.
your AF. If you didn't have your AF, we could probably try it, and I could call you later and see how you're doing, but I'm just worried because if we put pressure, if you're struggling to breathe and your oxygen levels are not high, then that puts your heart under even more strain.
Right.
Sorry.
I'll have to... Can I phone my husband?
Of course you can. Of course you can. Let me send a message to them to get an ambulance.
Oh, hello. It's your dear wife here. Just to let you know, I'm going to hospital. I'm with the doctor. My oxygen levels are all over the place. Something's going on.
Hello, my name's Dr. Taylor. I'm phoning from Boroughbury Medical Centre. I wanted to send you a 75-year-old lady who's got known hypertrophic cardiomyopathy and atrial fibrillation. She's really quite short of breath. She's feeling very tight-chested. She's desaturating down to 93%. So I'm going to send her in by blue light ambulance. But I wanted to let you know because of her complicated cardiac background. OK, then. Thank you, then. Bye-bye. Come in. Hi, I'm Rob. Hi. This is Kay. So she's come in with worsening shortness of breath and a tight chest since this morning, but it very much feels like her breathing is really tight. But she struggled to walk across the car park and she's struggling to move and speak. So ambulance is on its way.
So shall I help you through into the main building? We'll get you on some oxygen, we'll get a nebulizer set up.
Okay,
Is that okay with you?
Absolutely.
Yeah,
Absolutely fine. Let's do it together.
Fine.
Thanks, Rob. No, I'm sorry to send you in, but I just want you to be okay. Just watch your step. All right.
Thank you.
All right, Rob. You just call me if you need anything, yeah? Poor lady. Oh. Hi.
Hello. Have you handed that patient over to Rob?
He's going to sit with her because the ambulance is delayed to 90 minutes.
Right.
So if she deteriorates, she will need to be blue lighted. So I think he's going to sit with her literally until they get... Apparently there's a massive, as is nationally, disaster with ambulances again today.
Okay.
So because she's in a place that they consider to be safe, they've downgraded her, even though she should be blue light, but because they've got other emergencies, they'll watch her.
Okay, that makes
sense. And then
sense.
if she then desaturates more, Rob will then call them back and say, no, I want a blue light right now. So.
Okay. Hello, yep.
You're not local here, you're from outside.
No, I'm from London.
Oh,
yeah.
London.
Yeah.
What country do you come from?
Portuguese.
Portugal. Oh, lovely. Well, I bet you don't have weather like this, do you, in Portugal?
No, I prefer hotter.
Do I detect an accent there?
South African accent.
South African accent? An amazing place.
Is that an American accent? That I'm
Yeah.
Right? Where are you from?
I'm from Alaska.
Unreal.
Where are you from?
I'm from Kenya.
Oh,
Yeah,
okay.
yeah,
I'm
yeah.
from Kenya too.
Oh, are you?
From Mombasa.
Ah. What's your accent? Where are you from?
Australian. But I have been here for a year and I've never lived
Do you
there.
like roast dinners though?
Yes.
Like gravy?
Yeah, it's kind of new to me. You don't really do them back.
Really?
I'll probably get it wrong.
Go on.
I think you are from Yorkshire.
Yes.
Estefanus.
Hi,
Hello,
how
come
you
in.
doing?
I'm Dr.
Right.
Ward. Hello, yes. I'm very well. Come in, take a seat.
Thank you.
Nice to meet you.
Yes, nice to meet you too.
Right. Tell me what's happened to you.
3 weeks ago, I think, after work, 2 o'clock, I sit in the front on the...
In the car?
Yeah, in the car, yeah.
Okay.
And then one guy hit from my side.
Okay.
On the roundabout.
Okay, so you were driving?
No, I'm not driving, I'm just sitting here.
So have you got some symptoms now? Do you feel unwell now, or you're just feeling okay, but you're worried?
No, I just worry. I just worry because...
You're worried?
Yeah, I was scared. I said, oh, because in here, yeah.
Okay, but do you have any pain? Do you have any discomfort or anything like that?
I just feel on here, yeah.
Just pain there?
Yeah.
Okay. Is it there all the time, or is it coming and going?
Coming and going like that, yeah.
Coming and going?
Yeah.
When it comes, how long is it there for?
Like quick it.
Okay, so quick, sudden,
yeah.
sudden pain. No cough?
No cough. No.
No shortness of breath?
No.
No.
Yeah.
Perfectly well otherwise?
Yeah.
Okay, good.
I have some medicine, like oil from Indonesia. If like feeling pain, just... Yeah,
rub the oil on.
Yeah.
Are you from Indonesia?
No, I'm in East Timor. My country is just small, between Australia and Indonesia.
Ah, so
you know Indonesia?
I'm Australian.
Really?
Yeah.
Oh, nice.
Yes,
nice.
I'm Australian. So in between.
So you know East Timor then? Yeah, because my country is very small island.
Very small.
Yeah, very small island. Oh, so nice to meet you.
Yes, nice to see you too.
Nice.
I don't think I've ever met anybody from your country before.
Ah.
We're neighbours.
Yeah, very close.
Let's have a look, shall we? So if you pop your coat off, yep.
Yeah. Because I never feel this before, yeah. So I'm scared, yeah.
So come and stand over this way for me a little bit. Thank you. So what I'm going to do is just have a little feel and press. Can I press on the front? Is that okay?
Yeah.
Nothing down on these ribs?
No.
So no pain at the moment, no?
Yeah.
Okay, good. Let me have a quick listen. Deep breath through your mouth. In and out, through the mouth. And out again. Good. I'll have a quick listen at the back. Another deep breath. Out again. Good. Pop that down.
Thank you.
Take a seat again.
I put this back.
So the good news is I'm not concerned. Okay? I don't think there's anything terrible going on.
Oh, thank you. That's good.
It may be related to having the accident, okay? It's possible. The pain that you're describing sounds very much more like the chest wall, okay? It doesn't sound like pain associated with the lungs, and it doesn't sound like pain associated with the heart either, okay? And I just wonder whether it is just, you know, something happens, you take a bit of a breath, the nerve gets pinched, causes some pain briefly, then goes away, okay? So I think at the moment, I don't think there's anything to worry about, okay?
Thank you, that's good.
And it should slowly ease off and go away, okay? If it doesn't, if it's getting worse, or if you become very short of breath, if you, trying to get your breath, okay? Or if you feel your heart racing, going fast, fast, fast. If anything like that happens, then please get back to us and we'll have another look and see.
Thank you very much.
Very nice to see you.
Nice to see you. Nice to see you.
Very good, yes.
Amazing. Oh, thank you very much. And nice to see you.
Nice to see you too.
Thank you.
Bye-bye then.
Thank you. Have a nice day.
Nice to see you.
Thank you very much. Yeah, thank you.
Thank you.
Hello, Stephen.
Hello.
Hello.
All right.
I'm Dr. Chris. Come on in. Nice to meet you. Have a seat. How can I help today?
I've been passing blood on and off for a couple of weeks. For 4 or 5 weeks before that, I was throwing up quite, and I thought, oh, it must be some type of bug. Then I passed some blood, and then it was all right. Then I passed blood again yesterday and Monday. So.
Passed blood. Is this back passage?
Back passage.
Okay.
Yeah.
So tell me a bit more about passing the blood.
Oh, bit of stomach ache and that, a pain in my side, and when I went to loo, it was all fresh blood, and then it happened. I was just sitting there yesterday, I felt big, and it was just literally leaked out last night. So.
Okay. So that leaked out without having your bowels open. You were just aware that you were just bleeding.
Sitting there watching the telly. Yeah.
Okay. You said you had a bit of tummy ache.
Bit of tummy ache, a bit of pain in my side as well.
Okay. So where was the tummy ache?
Base of my stomach.
And when was that?
That was just before I went to the loo.
Oh, so you had pain, then you went to the loo?
Yeah. It was like, like an upset stomach pain, to be honest.
But no change in your bowels?
No, that's been quite good.
Do you feel okay in yourself, apart from these aches and pains?
I feel a bit drained, to be honest. Last few weeks I felt really drained, just in... I'm sleeping all the time, and I never hardly sleep. I can be in bed half past 7 of the night, and then I'm just falling asleep in the van, going to work, falling asleep, coming back, and I've never been like that.
A bit more tired than usual?
Yeah, a lot more,
right, okay.
Yeah.
So going back to the blood from the back passage, has it ever happened before?
It's happened on and off for years, but last time it happened, it was deep-rooted piles, actually inside me.
Yeah. Do you think it's the same problem again?
I don't know, it doesn't feel like I've got piles this time.
OK, we'll have a look. We'll have to examine you, have a look at that.
Yeah.
Do you want to lie on the couch so we can feel your tummy? Is that OK? So I'll feel your tummy and then we'll have a look down below. Do you want a chaperone to come in, want to do this?
No, I'll be right.
OK, do you want to roll on your side and face that side so we can have a look down below? It's a bit of cold jelly.
Yep.
Prostate I'm feeling.
Yeah.
OK, there's no blood there today.
No.
OK, thanks so much. Do you want to get yourself dressed? OK. I couldn't see any piles. I couldn't feel anything else that might be causing it.
Yeah.
But I think we probably need to get a look and see what's going on because you've had it before. Yeah. We need to check out what's going on with that. So I'll arrange that as well. When a patient comes in and complains about rectal bleeding, the first thing I think about is this cancer? That is what you have to exclude. Rectal bleeding is usually caused by a pile or a cut in the anus. That's because it's fresh red blood and it has to be coming from around the bottom. That's less likely to be cancer than patients that come out saying, I've got blood mixed in my stool, or the blood is darker, meaning it's not so fresh, which means it's travelled further down. When I examined him, I was hoping to find a local cause to explain the bleeding, and I couldn't find that. And therefore, I thought it was important to refer him to find out where that bleeding is coming from.
OK.
OK, thanks so much.
Yeah, cheers. Thank you very much.
All the
OK,
best.
bye.
Take care. Bye-bye.
Okay, bye.
Brilliant.
See you
Thank
later.
you. Have a lovely day.
Thank you.
Bye.
Bye.
Hi, Aneta.
Hi, hello.
Come on in. Come and have a seat. I'm Dr. Beecraft.
Hello.
How can I help you today?
So, I'm coming with pre-existing problem.
Okay.
I have this uterine fibroids. Last time when I spoke with GP, they told me they are not planning to do anything with it, which I found a little bit strange.
Okay.
So I did a lot of research since then, and I even spoke with like few doctors to get second and third opinion.
Okay.
And they all suggested, they even sent in like, I have to remove them.
Okay. Tell me a bit more. So why did you have a scan done in the first place?
I wasn't feeling well. I was experiencing pain in my left groin, which was even like spreading to the leg. I did ultrasound, and then it was shown that I have
That's
this
what they
uterine
found.
fibroids.
Okay.
Yeah,
Okay. And how are your periods?
and they are quite okay.
They're not
Quite
causing you.
regular.
They're regular. They don't cause you particular problems.
They're just very painful.
Okay.
Yeah.
Okay. So the pain is the issue. And how do you manage the pain at the moment?
I always take some painkillers.
Just painkillers. Okay, fine. So this is you. If I was to cut a slice through you like this. So this is at the top of your vagina. This is your womb, or your uterus that we call it. And these are the beginnings of the tubes, which kind of lead to your ovaries. This is one big muscle. Okay, so your uterus is a huge muscle, which is there to push out the baby in the future. And fibroids are little bits of extra muscle within it, and they can be in different places. So sometimes you can have the fibroid just within the whole normal structure of the womb. Sometimes it can be here, and other times they can be a little bit more on the outside.
Yeah.
This one becomes a nuisance because this is the lining of your womb that you lose as your period each month. That means this extra bit of area here means you will often find that the bleeding is more heavy. This one, type of one, doesn't tend to cause any particular problem. It's just there. Sometimes if they're on the outside, they can put pressure on some of the other structures that are there, so bits of your bowel and things like that. Yours, from the scan that you had done recently, is about 5 centimetres, so probably about this big. Okay.
Yeah.
And this fibroid is actually on the back.
Yeah.
If it was here, then I would say, fine, that's what's there, it's causing your pain, but actually yours is around the back, so it might not be the reason for your pain. It's really difficult to say what's the best thing to do. These will never, ever turn into a cancer, okay? These are innocent growth, so there's no reason to have to remove it unless you're getting a lot of symptoms. And if we can't control the symptoms that you're getting with other measures, so be pain relief if pain's your problem, or ways to reduce the heaviness of your bleeding is all an option. And so there are different things to do apart from just saying, let's chop everything out, okay? Because having a surgery on your womb is a huge operation to have, and there are risks with it. But if you're wanting to pursue that, I'm happy for you to have an appointment, at least with a gynaecologist in the UK, to discuss that.
Yeah, I would like that.
You'd like that, yeah, okay. But I, to be honest, wouldn't be particularly concerned by your scan, given that the only symptom you're getting is the pain with your period.
Okay, but you know, these fibers can grow, they
They
can
can
become
grow.
bigger, and then it will be harder to remove them.
They might grow, but they might not grow. They might shrink a little bit, so sometimes that can also be the alternative option. So everything is a way of balancing. There is no definite thing that you must do this or you mustn't do that kind of thing.
I think just the
So-
best way would be to check them again if they grow since May.
Yeah, so what I would suggest we do is we ask the gynaecologist for their expert opinion to see what they feel is appropriate. So I will make a referral to the gynaecologist. The waiting times to see a specialist are very long at the moment, okay? So it might be many, many months before you have this opinion. It might be 6 months or so at least, okay?
6 months?
Yeah.
Mm-hmm.
Doctor, please help me then. Refer me to the dermatologist.
Book me in for 6 weeks' time then, if you can.
Right.
The danger for you is to keep going and seeing another specialist, another doctor.
You think?
You're under already a number of people who are trying to look into those sorts of things.
Sometimes the danger is you ask 5 people and you get 5 different opinions.
That's, yeah.
So if, after a month, I've needed somebody to refer me, would a GP do that, to refer me to?
Yeah, I think they would.
I can refer you and see what they say.
And also, I suffer from eczema anyway, so they can...
They will have no cure for the eczema.
6 months. Okay. I didn't expect to hear
Yeah,
that.
which is partly why I feel like rather than focusing on that appointment, I wonder whether there are other things that we should be concentrating on here.
Like what?
Well, I think it's managing your symptoms, so it's about the pain relief, maybe doing things to reduce the heaviness of your periods as well.
And period is not very heavy. I would say it's normal.
Okay.
But I'm more concerned about this, and
I
maybe
can hear
this
your concern.
pain in the groin is quite often.
Yeah.
Sometimes it can be really difficult to allow the patient to leave the consultation room feeling that they've got everything from it that they were expecting. And that can be quite a challenging part of the job, having to negotiate and try maybe to get the patient to understand where you're coming from. Since the pandemic, the waiting times for hospital appointments have really increased, and that's putting an additional strain on general practice. There are a lot of frustrations, understandably, from patients with this that we have to manage and deal with. And it's also therefore really important that every referral we make on to secondary care is the right and appropriate thing for us to be doing.
Leave it with me, I'll make the referral
Thank you.
and then we'll go from there.
Okay, thank you.
All right, thanks for coming in.
Thank you. Bye.
Bye, have a good day.
You too.
Oh.
Hello, Mohammed.
Hello.
Hello, my name's Dr. Ferdinand. Coming in. Right.
I believe you know the history.
So, yes, I've seen a little bit written on your notes.
I have been seeing Mr. and Mrs. Harris.
Yes.
The pain is excruciating.
Yeah.
It's unbearable.
Is there any signs of things improving yet?
No, I can't see any signs of improvement. No sign of the swelling going down.
Okay.
And no signs of pain decreasing. The blood test showed I got no blood clot. And Saturday I spent 3 hours in the DVT clinic.
Mm-hmm.
All they can say is it's a very severe infection.
Yeah.
Which will be treated by antibiotics. And
exactly, and so you've got some antibiotics called flucloxacillin.
Yeah, I got,
yeah?
yes.
And you're taking those 4 times a day at the
Yeah,
moment?
4 times a day. I only came in because of these bubbles are coming up and bursting.
Are you feeling unwell at all? Have you got a temperature?
No, I don't feel unwell. I haven't got temperature.
So you've got a lot of pain. Are you taking any pain medication?
Well, only pain medication is this.
Just paracetamol?
Unless you can suggest me something stronger, because the pain is greater than the tablets.
Okay.
Tablets can't keep my pain down.
Absolutely. Okay. Well, yes. So we can definitely have a chat about maybe giving you something stronger.
Yes.
Are you able to come up on the couch here, maybe?
Yes, I can.
There you go. And maybe we can have a proper closer look at it. Hold on. Right. Let's have a look at both of these. Okay. Yeah. So since the bubbles burst, has there been any more fluid coming from it?
No, only them 3 bubbles burst and I cleaned them.
So it's been dry, hasn't it?
Yes, and now they dried off.
Okay. So it's not too hot, which is good. What I want to do is I want to put a pen line to indicate where the redness and swelling has gotten to.
Yes.
Because that then allows us to see if the swelling is getting worse. If the antibiotics are doing what they're supposed to, the redness and swelling should move away from the line, so it gets smaller. Are you able to roll over onto your front for me, so then I can mark the front of it as well?
I say the bubbles come up, they're releasing a little bit of pressure.
Yes, exactly. And so what's happening when you're getting these bubbles in the skin? It's because the layers of your skin, they're like the layers of an onion.
Yeah.
And what we're doing is there's a bit of fluid that's developing between the layers of the skin, which gives rise to these blisters.
Yeah.
And so when they burst, that's the fluid obviously comes out.
Yeah.
And that's a good thing, actually. As long as the redness and swelling is moving away from the line, so back towards the middle, that will mean that the antibiotics are working, OK?
Has it got anything to do with cancer or anything like that? Or is it too early to say?
No, so cellulitis, unfortunately, is it can happen to anybody. It's not usually related to cancer at all. Certainly, if it was a blood clot, if it had been a deep vein thrombosis, then that, for some people, can be a sign that there may be a cancer somewhere else in the body. But we know it's not that, so that's reassuring. Do you want to come back to the chair?
Yeah.
To be honest, I think it's going in the right direction from what I'm reading and from what you're telling me. I think the most important thing is to keep going with the antibiotics. We'll increase your pain medication, but I think we need to get you back probably in another 7 days' time just to have another look at it and just make sure that it's definitely improving. If not, if you're concerned things are getting worse, obviously get back in touch with us before then. I'll happily be able to see you later this week if need be. OK?
Right.
Great. All right, Mohammed.
Thank you very much.
Thank you very much for coming to see me today.
Thanks very much. Thanks for all the help you've given me.
No problem.
Thank you. It's all appreciated.
No problem. Thank you.
Thanks.
Thank you, mate. Good to see you.
Nice to meet you.
Nice
Take
to
care.
meet you.
Bye-bye.
Thank you. Bye.
All right.
Okay,
Thank you very much, Ellen.
Thank you. Take care. Bye-bye.
Perfect.
Great. Thank you very much.
No problem.
Have a good rest of your day.
Bye-bye.
Bye-bye.
It can be really satisfying to be able to reassure a patient when they're really worried about their symptoms, simply because being a doctor is all about easing suffering. And when somebody's worried about something, feeling anxious about a symptom, being able to give them that reassurance solves that for them. And that's a really great feeling for me.
It just make me feel better, and I don't care what you do to me.
I might change the position of my hand and it'll start again. I was concerned that it might be Parkinson's.
Can you remember that address I told you?
No.